Hi everyone, today we are going to discuss about hair loss. So what is hair loss technically known as? It is known as alopecia. Previously, whenever any young guy or a young lady used to come with hair loss, what do they used to do? They go to their hometown or their parents tell them, no, you have shifted from Dubai to some other place or you have shifted from Kerala to Dubai. It's the water that is changing or vitamins you are not getting. So they change the oil, change the water, whatever, give multivitamin for hair growth. Now people know that alopecia or hair loss is treatment is dependent upon the cause of alopecia. Whenever you have hair loss, the four reasons are there for hair loss. Number one is whatever dandruff or alopecia caused by tinea capitis. So whenever you are having dandruff, use a shampoo, correct your dandruff and your alopecia will totally go. Second type of alopecia is known as a patchy hair loss, where some people lift the hair and tell doctor, I am losing my hair as a 50 paisa point like that. Just there is circular patches of hair loss that is known as alopecia areata. So that is due to autoimmune phenomenon. People go to a skin doctor, they give steroid injections and make it normal. Sometimes thyroid disorder can also be associated with that. In short, understand two things. Hair loss technically is known as alopecia. And whenever you are having alopecia, don't generalize it. Look for the cause. Tinea capitis of dandruff, use a ketoconazole shampoo and correct it. Alopecia areata, especially ladies coming with patchy hair loss with 50 paisa, 25 paisa like hair loss, go to a doctor, take a steroid injection and get it corrected. And the most common cause of alopecia, which men and female come with, is androgenic alopecia. Look at all the film stars that we see. Almost 80% of the Hollywood film stars and 19% of the Bollywood film stars are always on whatever hair transplant done. Now we know Turkey has become the capital of hair transplant, including the football stars, everything they were advertising in the YouTube, they themselves going to Turkey getting a hair transplant. So that has become a trend. So the male pattern baldness is known as androgenic alopecia. Men lose hair in the frontal aspect, but they have hair in the occipital or the side area. So what do they do in transplant? They take the hair from this area, occipital area, and reimplant in the frontal area. So that is known as androgenic alopecia. And now we know that androgenic alopecia doesn't start abruptly at 30 or 40 years. Your androgenic alopecia or thinning of hair starts by the age of 16 to 18 years. By the age of 30 years, you lose 50% of the hair. Then by the age of 35, 40, you go for a hair transplant. So now the drug of choice for androgenic alopecia is known as finasteride. That is why internationally, American Institute of Clinical Endocrinology recommendation says that the moment at the age of 16 to 18 years, you think that your hair is thinning out because of high testosterone in the body, start the tablet of finasteride 1 milligram or Propecia 1 milligram and maintain whatever hair that is there in the body. Once you take finasteride at the early stage, you can maintain your hair until 45 or 50 years. What do people do now? They go for transplant hair from here to here and then take finasteride. But actual guidelines is just like you are taking insulin in type 2 diabetes, go for diet exercise tablets and then take insulin. Just like that, by the age of 16 to 18 years, once you start your alopecia, start finasteride, which reduces your testosterone level and maintain the hair per se. And the last cause of hair loss in females, some females after delivery, after pregnancy comes and doctor, I can't comb my hair, doctor, my whole hairs are falling. So that is known as telogen effluvium, where the thickness of the hair is coming out and the hair root is peeling like itself. So whenever a female tells of excessive hair loss, especially after pregnancy, after delivery, then always do 5 things. Check your thyroid. If that is low, treat that. If iron or ferritin is low, treat that. If vitamin B12 is low, treat that. If protein is low, treat that. So hair loss, always alopecia is divided according to the cause. If you're having a dandruff or tinea, go for a ketoconazole shampoo, correct it. If you're having an alopecia areata, go to the skin doctor, take an intralesional steroid, check your thyroid and gluten also. If you're having an androgenic alopecia, 99% of men have losing of hair here, take the tablet of finasteride, maintain your hair. Still you are losing hair after 45, 50, then go for a transplant. Whenever you are having a diffuse hair loss in a lady after delivery, after chemotherapy, you know it can be thyroid, calcium, vitamin D, iron, protein, B12 deficiency, treat that. So hair loss during the falling phase of hair should be treated rather than when you become totally bald. When you become totally bald, you have no other option other than you are going for a wig or a hair transplant per se. So this should be kept in mind whenever you are having a feeling of hair loss or whenever you think that your children is starting to lose their hair by thinning of the hair. Thank you.